Hello, good morning, good afternoon, or good evening, depending on where you are joining us from. And welcome again to this usual Thursday morning briefing from the Africa CDC, focusing on the situation of the COVID-19 pandemic on the African continent. As usual, we have Dr. John Nkengasong, who is the director of that institution, and he'll be bringing us the roundup of the situation in Africa since the last time that we met, as well as providing information on other events that are upcoming as Africa continues to fight against the COVID-19 pandemic. My name is Wayne Musabayana. I'm head of communication at the African Union Commission. Before I hand you over to Dr. John, let me just remind you of the email, the WhatsApp number that you can use to send in your questions. And that number is +251 94 550 2310. +251 94 550 2310. But of course, you can ask your question live, and alternatively, you can use the question and answer section. Well, let me now call upon Dr. John Nkengasong, and as I've said before, he's the director of the Africa CDC, to give us his briefing for this Thursday morning. Dr. John, good morning, and you have the floor.
Good morning, Wayne, and greetings to everyone on the platform, as usual. We'll follow the same trends we do all the time. We give you the epidemiological situation of the COVID-19 on the continent. Then discuss what we are doing at Africa CDC and the African Union to support member states, and conclude with an update on the vaccine situation. So let's start with the epidemiological situation. As of today, November 25th, a cumulative number of 8.6 million Africans have been infected. Remember, these are reported numbers from member states. Of this number, unfortunately and regrettably, 222,000 deaths have occurred. And this represents a case fatality rate of 2.6%. If you look at the trends across the countries, we notice that, of course, as we said last time, 84 countries have already experienced the third wave. And as we speak today, 11 countries are now experiencing or have experienced the fourth wave. And these countries include Algeria, Benin, Burkina Faso, Egypt, Eritrea, Kenya, Mali, Mauritania, Mauritius, Somalia, and Tunisia. This is significant because, as we have discussed, if you recall previously, we were dealing with the third wave, and then few countries had experienced the fourth wave, and now you see that 11 of our member states, 55 member states, have now either gone through the fourth wave or are currently going through the fourth wave. Importantly, one country, Mauritius, is actually experiencing the fifth wave. So these waves will continue to come and go unless we scale up vaccines and continue to maintain good public health practice. In terms of the variants, a total of 45 countries have reported the Alpha variant. 41 countries have reported the Beta variant. 43 countries have reported the Delta variant. And as of last week, one additional country, that is Comoros, reported the presence of the Delta variant. 2 member states are reporting the Gamma variant, and since the number has not changed since the last time we reported. Let us now look at the trends. That is the 1 week trend, and then we'll look at the 4 week trends. As of, if we compare the week of November 8 to 14, and the present week, which we call it the epidemiological week 46, that is the period spanning between the 15th of November to the 21st of November. As a continent, we have reported a cumulative number of 24,474 new cases. And this represents an 11% decrease from the previous week. If we now look at the number of deaths, the new deaths, as a continent, we reported a total of 973 new deaths across the continent. And this compares to the last week, the previous week, where the continent had reported 1,148 new deaths. This represents a 15% average decrease in terms of new deaths. If we now look at the 4-week trend, that is the week between November 25th of October and 21 of November, we noticed that we have seen a steady decrease of 6% average decrease over the last 4 weeks. And the following countries, the regional trends are as follows: 8% increase in Southern Africa, 8% decrease in Eastern Africa, 7% decrease in Western Africa, 2% decrease in Northern and Southern Africa. If we now look at the deaths over the last 4 weeks, we've seen an average decrease of 8%, average decrease of 8% over the last 4 weeks. Unfortunately, our testing numbers are not encouraging. They are not in the right direction. Cumulatively, as a continent of 1.2 billion people, we've conducted 81 million tests. And just this week alone, this past week alone, the continent has reported conducting about 798,000 tests. And that compares to last week, it represents a 15% decrease. At a period where we should be testing more, unfortunately, a continent is not doing a lot of much testing, which again, I suppose here to make an appeal to all member states to increase the testing. We at Africa CDC continue to supply countries with a lot of antigen tests and PCR, that is a molecular test. So please, we should use those tests as much as possible. The only way to find infections and control them is to conduct more testing. In terms of vaccine, in terms of important events coming up, first of all, we have 2 important events coming up, and we will come back to this in due course. First of all, there's going to be an update on the 6th and 7th of December in Kigali, where we will be reporting the progress that we have collectively made in advancing the continent on the vaccine manufacturing front. If you recall, on April 12 and 13 of this month, we hosted a summit, a vaccine summit in Addis Ababa, where several heads of state spoke at that meeting. And at the end of that meeting, President Tshisekedi, as the chair of the African Union, launched the Partnership for African Vaccine Manufacturing, in abbreviation PAM. So the purpose of the meeting we'll be hosting in Kigali will be to provide an update on that. So stay tuned on that front. The second meeting that we will be hosting in December, that is, to be very specific, December 14 to the 16th, is the first international conference on public health in Africa, the first ever international conference on public health in Africa. I'm very pleased to say that already over 8,000 participants have registered, and several heads of states will be speaking, including our own chair of the African Union Commission, His Excellency Musa Faki Mohammed. You've probably seen some of the speakers on Twitter. So I invite you all to plan to attend that very historic meeting. It's the first of its kind. It will provide a platform for the continent to review what we have gone through over the last 2 years on the continent, fighting COVID and the impact it has on other infectious diseases, and begin to provide an opportunity to reflect on where we go to, or how we reimagine public health as a health issue, but also as an economic issue and a security issue going forward. So let me then conclude the remarks with an update on the vaccine and vaccination. As of 24th of November, the continent has received a total of 403 million doses of COVID vaccines in 54 member states. Again, I repeat, 403 million doses of vaccines. Of that, 221 million doses of vaccines have been administered, which corresponds to 55% of total supply. So what you are seeing now is that a lot more vaccines are coming in now, and the uptake is challenged because of the logistics and of delivery. The coverage, that is the total number of people that have been fully vaccinated today, stands at 6.6%. 6.6%. Some countries in Africa are making good progress. Morocco has vaccinated about 61% of its population fully. Egypt, about 12% of its population fully. Algeria, about 11% of the population fully. And Tunisia, 33% of its population has been fully vaccinated. In terms of the AVAC, the African Vaccine Acquisition Task Team deliveries, from the 17th to the 24th of November, 7.2 million doses of Johnson & Johnson vaccines were distributed to 15 AU member states. So far, since we started the distribution, a total of 21.7 million doses of the AVAC vaccines have been distributed. That is mainly the Johnson & Johnson. If we include those doses that have gone to the Caribbean countries, it brings the number up to 22.4 million doses of vaccines that have been acquired through and distributed through the AVAC mechanism. You always have to keep in mind that this is a single dose vaccine, which means to bring it to the equivalence, and I use the word equivalence deliberately, you have to multiply that number by 2, which means that if it was either the Pfizer or the Moderna or AstraZeneca, it would be a total of at least 44 million doses equivalent of the other vaccines there. So very important. We're very encouraged with this progress that we are seeing. And just to end, and we'll have a separate briefing on this, but I just wanted to flag this up that the first delivery of the vaccines that were purchased by the MasterCard Foundation contribution will be arriving the continent shortly. Or arriving the continent, meaning the distribution will start of those doses of vaccines. I think we're very encouraged. We did mention this to you that we had a partnership with the MasterCard Foundation. We had moved those deliveries to November, and these deliveries will go to member states free of charge. Thank you, Wayne, and over to you.
Thank you very much, John. And we continue to witness there the good work that Africa is doing in terms of fighting the COVID-19 pandemic. So now let's go straight to people who are online. And the first one is Sophie Mukwena from SABC. Good morning, Sophie. Sophie, good morning.
Yes, good morning. Dr. Nkenkesong, we see South Africa experiencing a rise in terms of their positive cases of COVID-19. And there are concerns that we may be heading towards the fourth wave. When you look at the past events during the campaigns, during elections, but also the reports that there is a new variant that is circulating in South Africa, and reports are that it is Botswana, Hong Kong, and South Africa. Are you aware as the CDC in terms of what's happening in South Africa on COVID-19 numbers? And then the reports about a new variant that is circulating.
And we are fully aware of the situation in South Africa. And again, remember, South Africa has been very transparent in reporting its cases, regardless of how severe the pandemic is. I think we continue to see good trends in South Africa, but worrying trends that it might be tipping back up in South Africa. And that is even more worrying because we are moving towards the holiday season, where there will be movement of people around. And if you recall last year, Sophie, around December, we predicted that in January, February, we'll see a sharp rise in the number of cases. And we saw that, okay, that is our, most of our, the numbers increased significantly, not just in South Africa, but across the board. So yes, we see that, we're seeing that trend in South Africa, and of course, we are observing that very closely. In terms of the new variant, we will not comment on that now, other than saying that, yes, we are in contact with the authorities in South Africa. We plan to have a briefing with them early next week to understand more, so that we know exactly what is this variant, what is the impact of the variant, because there are so many variants out there, but some of them have no consequences on the trajectory of the epidemic. Excuse me, and some do have a significant impact, like the Delta variant and the Beta variant that was reported in South Africa. Excuse me. So please bear with us so that we have a chance to look at that data very carefully before we can make any public pronouncement.
All right, thank you. We have someone who's written into our question and answer section, and that is Mario Baptista, who is with Lusa News Agency of Portugal. And so Mario says, how do you explain that some countries in Africa are already administering the third shot of the vaccine? And he mentions Algeria, Tunisia, and Cape Verde. And he says this is happening while the continental average is only around 6%. So that's the question for Mario.
No, absolutely, Mario. Our position in this is very clear, and it should make what I call a common sense position. As a continent, we need to get to 70% of full immunization, which means people that have received 2 doses of vaccines. Today, as I just mentioned, we are at 6.6%. So from a policy and programmatic standpoint, our goal should be to lift the continent from 6% to 70%, not trying to do boosters, because we know and are aware that if you have 2 shots of vaccines, it offers a remarkable effectiveness in terms of protecting you towards severe disease and hospitalization. So that's overall policy guidance. Now, individual states tend to do what they have to do. I mean, Africa is not a country. Africa is made out of 55 member states. Our advice for that to member states who have succeeded in scaling up vaccines and then interested in doing the boosters is that you target those who have immunocompromised conditions and the elderly. I mean, you start with that number, but you do not make boosters of the vaccines, especially the third shot, a universal thing, because we truly don't have the vaccines on the continent. Let's prioritize getting from 6% to 70%, and then we pick it from the ones we have immunized a good chunk of the population.
Thank you very much for that. Let's go back online and say hello to Gabrielle Steinhauser, and she's with the Wall Street Journal. Good morning, Gabrielle.
Good morning. Thank you so much. I have a question on these new COVID-19 antiviral pills, where the late-stage trial data has been very promising. And obviously, there have been some deals to make the manufacturing or license the manufacturing to generic manufacturers. Are you, despite these moves from the pharma industry, are you still concerned that there could be quite significant delays for African countries to access these pills, given that it will take time to scale up the manufacturing? And also you mentioned that there's not enough testing happening in Africa, which is obviously a key precondition for taking these pills because they require this very early diagnosis. So I'm just trying to get an assessment from you of, what these pills could mean for the continent and how concerned you are that we might actually see a situation similar to the vaccines where African countries are being left behind. Thank you.
No, absolutely, Catherine. There's no doubt that, first of all, let's celebrate the good news. The good news is that these drugs have been available. There's antiviral, one from Pfizer and then one from Merck. And especially the drug from Pfizer, which is showing us that with an efficacy of up to about 89%, that it will be remarkable. The good news also is that Pfizer is ready to let the manufacturing be produced elsewhere. There is the generic part of that. So we are in discussions with both companies. Just yesterday, we had an extensive discussion with Pfizer. We had Strive Masiwa and others to continue to negotiate on how we can get those drugs at affordable rates and as quickly as possible for the continent. So we had those conversations, and that is the third conversation we're having with them. So we are very encouraged with what we are hearing. Today at 10 o'clock, 10 o'clock Eastern time, we will be discussing with the folks from Merck together to see what we can do in terms of moving that manufacturing as quickly as possible. We have other groups in Africa like Aspen are also engaged in these discussions. So we are not just waiting for these things to play out. We are actively engaging to see what we can do so that we avoid the inequity and inequality situation that we have observed for diagnostics and vaccines. With that instrument, if we have that, the drugs, then we have three things that we have at our disposition. We have the public health measures that we can rely on, backed by testing. We have the vaccines, and then we have the drugs. So that gives you a very strong toolkit to fight the pandemic on the continent. I want to be very clear that vaccines alone will not get us over the finish line. We have to do vaccines, and we also have to do treatment and combine both of them and together with public health measures. So your point is very relevant. We are working as hard as possible to make sure that the continent is not left behind with respect to these new developments and new peers.
All right, thank you. Judith Akolo joins us from the Kenya Broadcasting Corporation. And she says, my question to Dr. Nkengasong is, are you optimistic that Africa will indeed reach the 70% vaccine coverage, given that people in countries with low infection rates like Kenya are reluctant to go out and get vaccinated?
I think, Judith, the 70% rate and even more is a programmatic imperative target that we must achieve for a continent, for our continent to be protected. You are seeing what is happening in Europe and also in the United States, where large numbers of populations have been vaccinated, but they're still challenged. Just imagine if they were not vaccinated, hospitals would be full with people suffering from COVID. We should remember and always remember and not be deceived that because we are at the trough of the pandemic, which means that we've gone through the peak and then we are at the base, that the pandemic is over. The pandemic, of course, we have seen these waves come in. They come in and then they slow down for about 1 to 2 months and then pick up back. And when the wave comes, they come severely. If you remember what I said a few weeks ago, 80 million, about 80 million Africans died during the third wave when the third wave surged. So again, this is an appeal to the population. Do not be complacent. This virus is dangerous, it's out there. You may not be seeing large numbers of infections and death during this transmission season, but you will have the next wave. Let there be no doubt. You will have the next wave. 11 countries in Africa are now experiencing the fourth wave, and you will have the fourth and the fifth wave. That's just the nature of pandemics. So again, my appeal to the continent is get out there and get the vaccines. And all of us should do everything possible to encourage our loved ones to go out there and get their vaccines.
All right, thank you, John. Liane de Bassompierre of Bloomberg says, can you specify which new variant you are looking at in South Africa? And is it the same variant as the one in Botswana?
Now, as I said, I mean, just please be patient with us so that we do not rush into giving you information that is not complete. We promise you that by next Thursday, next Thursday, you get a full picture of this. This is emerging, and there's no value in giving you information that is not accurate. We want to come back to you and give you the exact information with respect to how many mutations are we seeing, and at which point is it at the 614 spike protein, and what is the effect on the potential effect of vaccines and transmission. That's all the kind of information that we don't have at this point, and until we see the data, process it will be not appropriate to giving you information that is not accurate.
All right, thank you. Let's say hello now to Maggie Fick, and Maggie is with Reuters. Good morning, Maggie.
Good morning, and thank you very much, as always. Dr. Nkengasong, I'd like to return to something you mentioned in your remarks, which is that we now have seen that South Africa and Kenya are experiencing a situation where the pace of vaccination is slowing, just as supplies are beginning to pick up. And I was wondering if you could please share more details about other countries on the continent that are experiencing the same problem now. Thank you.
No, thank you. I think I did mention a number of countries that are making very good progress in terms of using their vaccines as they arrive. And as more vaccines come in, we need to build the right partnerships to support countries to take it, to use those vaccines. Otherwise, it will be extremely difficult for the input and output to be equal. And we have already seen that in some countries, like in DRC, where many vaccines have arrived and they have immunized about 128,000 people. We see that across the board in Cameroon, in many countries. I think that they are struggling with that. It's not necessarily about hesitancy. It's about moving vaccines from the airport to the arms, the logistics of moving that. So many countries are in the category I'm describing.
All right. Thank you very much, John. Let's say hello now to Elizabeth Merab. And Elizabeth is with The Nation Africa in Nairobi in Kenya. Elizabeth says, Europe and many countries in the West are experiencing a surge despite having high vaccination coverage. Now, with Africa's low coverage, are you concerned that the continent will experience the surge?
There's no doubt about that. With as I said earlier in my introductory remarks, 11 countries are already moving towards the fourth wave or have experienced the fourth wave. There's no doubt about that. But let's step back and see what is happening in Europe and the United States. This is the cold season or the winter season. People are spending more time indoors now, and that contributes to the propagation of the virus, because when people are indoors, they don't necessarily wear masks and they consider themselves safe. And if you just think of how many times we have been indoor and you just lower your guards, okay, with respect to maybe during dinner or lunches, people take off their masks, they eat, they talk, and transmission occurs. I mean, that is just what is happening. And then secondly is that there's still, even though the vaccination numbers have increased a lot in Europe, you still have a large number of people that have not been vaccinated. And that those people that have not been vaccinated continue to be a pool, a reservoir for transmission of the virus. So, I mean, we have to learn from that. very clearly. And that's why, going back to Judith's question about vaccination in Africa, we have to continue to move our vaccination up to the level it's supposed to be. It is not a choice. Africa is not an exception. We are not different from what we are seeing in Europe. So there will be a fourth wave, there will be a fifth wave, and the only thing that will enable us to control the pandemic is the level of vaccination. If you actually look at number of people in Europe that have been infected, it's not whether you're vaccinated or not, it's really do you end up in hospital or do you end up dying? And clearly the numbers are telling us that if you are vaccinated, the mortality there, that is the number of people who end up in hospital or severely sick, decreased. So I think that is the lesson number one we should learn from what we are seeing in Europe.
All right, let's go to our WhatsApp group. And this question is from Sarah Jerving, who is with DEVEX. She says the global target set by the WHO is to vaccinate 70% of each country's population by the middle of 2022. How aligned is that with the goals of individual African countries, and how feasible is it? Then she goes on to say, in a recent interview, Gavi CEO Seth Barkley said that they are planning towards that figure of 70%, but he also said that they are going to have to ask countries that are part of COVAX if that is what they want. So in many countries, a large percentage of the population is young. Looking at World Bank data, some of the countries in Africa have 1 to 14-year-olds accounting to upwards of 30 to 40% of a country's population. The question related to that, do these countries need to hit the 70% mark?
That's a very good question, Sarah. I think there's clearly, if you remember, the African CDC and the African Union and the head of states had endorsed a 60%. Let me start off with 60%. We were the first to say that we will vaccinate, we wanted to vaccinate up to 60% of the population. At that time, the world didn't agree with us. I mean, they didn't believe that that was necessary, or they didn't. I mean, it was simply that you needed 20% of the population to be vaccinated, and you'll be fine. I mean, we argued on the contrary. That was last year. To be very specific, August the 20th. But I'm very pleased that the world has moved closer to a position where they're now saying that we need to vaccinate 70% of the population. We are not vaccinating children as of now. I mean, as you can clearly see, but this situation is very fluid and is very dynamic. If you recall, when vaccination started in the developed world, they were not vaccinating children. And now they are vaccinating children, as you can you see in both the United States and Europe. So you cannot exclude anything for now. But again, you don't get to 70% by skipping from 0 to 70%. We have to develop an approach there. You vaccinate the vulnerable population, the active population, right up to the age of 18. And then that is where you start. You categorize it and vaccinate it. Then you learn from the epidemic and you see how you can expand it to the lower age. I mean, do we move the target of vaccination up to 5 years old? We don't know. We'll only wait and see what the data will teach us. So the short answer to your question is that yes, our population is young. Let's try to set a target of vaccinating as many as possible. The children, will be a different conversation, and data, only good scientific data will inform us as to how low can we go to vaccinate, the population. But for now, our priority is to vaccinate those the children up to adults, and then look at the younger population, that is the 5 years old and to up to about 12 years old, and wait for and see how the data will play out.
All right, thank you very much. I think the other part of Sarah's question was, how aligned is the 70% goal? how aligned is it with the goals of individual member states on the African continent?
So the 70% is a target that has been set at a global level. And individual countries will need to look at their own population structure and then decide how much they want to invest in going down to the young age. And again, from a scientific point, I would say that your priority is not to vaccinate between the 5 years and the 14 years old. That is not a priority for now. It should be to vaccinate people above that age group. Okay, and so that gives you a guidance on how you look at your population structure within each country. So I don't know that countries have set different targets, but we need to have a common target that will guide everybody across the continent.
Okay, thank you very much, John. Let's say hello to Simon Ateba. Simon, good morning, and please go ahead.
Yes, good morning. Thank you for taking my question, and thank you for doing this press briefing. This is Simon Ateba with Today News Africa in Washington. I was just wondering if Dr. Nkengasong, if you could explain to us again, why is it that with no mask, no vaccine, no first-class healthcare system, no money, no food, no way of social distancing, no way of avoiding crowded buses, spaces, Africa remains the least hit by COVID-19? Does the Africa CDC need to carry out more studies to understand why? And I'm not just trying to give a false sense of security to anyone, but the facts seem to speak for themselves. The doom and gloom that was predicted by the West has failed to materialize in Africa. I mean, here in the US, we have vaccine, we have mask, we have everything, but more than 1,000 people continue to die every day. And it's not just now, the same thing happened like more than 100 years ago. So do you have to do more studies to know if other factors like genetics and climate and environment have something to do with the way COVID killed people? Thank you.
Simon, you're absolutely right. We have published a paper in Science, and that was published, I believe, in January of this year, that you can, I ask that you read that. We titled it The Puzzle of COVID-19 in Africa. There's a lot we know, and there's a lot we still don't know about COVID infections in Africa. But this is what we know. We know that the number of infections that we are reporting are a gross underestimate. That is period. We based on our own studies, as you rightly said, Africa CDC is conducting studies, serologic surveys to look at the number of infections, the number of people that have been exposed or are currently infected. And in some countries, that number is about 10 times more than what we have seen reported from the countries in terms of the molecular tests that they use, the PCR-based tests that are used in doing the reporting. If you now do a serology study, which says, ask the simple question, have you ever been exposed to COVID? That is infected, you get rid of it, and you don't know yet. The answer is yes. So that number, so the numbers we are seeing is clearly, the number we are reporting from member states is clearly an underestimate. So that is one. The second thing is that the number of excess deaths that we have on the continent is similar to what we are seeing in other parts of the world. That is the excess deaths, meaning deaths that are occurring due to COVID, not necessarily because of COVID. For example, if you have severe malaria and you show up in a hospital or a clinic, and that clinic has been closed or all the beds have been taken by COVID patients, then you end up maybe dying of your malaria. It is because it is due to COVID that you died, not because of COVID. So I think that the excess deaths are also represents a large number of people that are not officially also reported. But having said that, you don't see the prediction that you mentioned earlier, that large number of people. Remember, there were predictions that about 3 million Africans would die within the first 6 months of the pandemic in 2020. That, of course, we don't think, even with the worst case scenario, if you take a 222,000 number of deaths reported, you times that by 10. I mean, it still doesn't give you, it gives you about 2 point something million, but now over 2 years, Okay, so that is, I'm trying to use a very crude simulation here. So we have not seen that. So yes, the answer is we need to do more studies. Some studies are beginning to emerge. We just read last week about interaction with malaria and COVID, where the investigators, I think those are studies that were conducted, I believe, in Uganda, where they were expecting to see a worsening situation of COVID in people infected with malaria, but they saw the reverse. I think that is and those studies were presented at the just ended a conference on tropical medicine that just took place there. So there's a lot we don't know about this virus. I mean, a lot we don't know with respect to the interaction that it has with other coexisting pathogens and the genetics. So we shouldn't exclude anything. We should just conclude this piece by saying that it remains a puzzle that science will continue to enable us to unpack, and we need to do more studies. And we at Africa CDC are doing more studies, and we'll be publishing more studies to explain our situation in the coming months.
All right, so thank you, John. Let's say hello to Sarah Kimani, and Sarah is with SABC News. She says, considering the number of vaccines that have arrived on the continent, is there a need for any country in Africa to introduce a vaccine mandates at this point?
I've always said that we shouldn't get ourselves to a point where the authorities need to implement a vaccine mandate. Having said that, because of the nature of what we are dealing with, that it is not about you and as an individual, it's about the communities. If member states or countries would go to the extent of buying the vaccines, and most of the other doses of vaccines have been bought by taxpayers' money, and other donations are coming in from the West, like the United States has done remarkable well in donating vaccines to Africa, and then the vaccines are not used, and it begins to be a moral issue for everybody that is not receiving the vaccine, because you are failing to protect yourself, but then also failing to protect the community because you are part of the community. And that's where I see a policy orientation from some countries that are thinking of imposing vaccine mandates. I think Africa would not be the only one. I mean, the United States has gone down that route, and other countries in the West have gone through that route as well. But my plea to the continent is simply that vaccines save lives. Go get your vaccine and protect yourself, protect your community and your country, so that we don't need to impose a vaccine mandate. But if that has to be done, I think there will be no choice of getting people to do the mandatory vaccination.
Okay, Andrew Meldrum from Associated Press says South Africa is experiencing an increase in new cases. Is this the start of its fourth wave? And is South Africa one of the 11 countries that are experiencing the start of the fourth wave right now?
We didn't call, on the list of 11, I didn't call South Africa there, but we are observing the trends. By next week or in the next 2 weeks, we should be able to have clarity of the consistency of this, the ticking up of the new cases in South Africa. So for now, we've not made a call on South Africa yet, but we are observing it very, very closely. I think Sophie also brought that up, but just give us a week or two to see what is happening in South Africa.
All right, we have
my sense would be that very generally, this is the holiday season we are going to in December, that many more countries will go in that direction because of the holiday season. So my appeal would be that we should actually celebrate wisely and safely. Celebrate our end of year, very deserving end of year festivities, but be wise and be safe. Do that safely.
Okay, we have a question coming from Rhoda Odhiambo of the BBC, and she's making a follow-up to a question, to the answer that you gave to a question that came from Sarah Jerving. And Rhoda says, if the Africa CDC believes that priority right now is not to vaccinate those aged between 5 and 14 years old. What then do you make of Kenya's decision to begin vaccinating teenagers, yet the vaccination numbers among the adults is still very low?
Those are policy issues within the country where each country would need to look at their situation and make that policy. What do I mean by that? Maybe, and just maybe, I don't know what is guiding Kenya's decision there. Maybe their focus is based on the epidemiology. They're looking at infections. They are looking at more outbreaks in that age group, especially for schools. Maybe they want to vaccinate that age group to promote a school in there. I just don't know. I mean, there must be a rationale why they're opting to do that. But the only thing that would probably be the strongest rationale would be that they want to target that age group to continue to promote the opening of schools. So I think that, as I said earlier, the vaccines are limited. The adults, again, let's remember what these vaccines do for us. They do not stop transmission. They really reduce mortality and hospitalization. Some, of course, because you lower the viral load around once you get vaccinated, you develop antibodies, it reduces the viral loads around the burden of virus around your nostrils and mouth areas, so that you can also imagine that it reduces the ability that you can transmit it to somebody else because it has reduced the volume of virus around here. But primarily what they do is that they reduce the hospitalization and deaths. And so the point then is that who do you want to prevent from dying? Is it the elderly, the young people, or children? Children and young people, based on the epidemiology and the science of this pandemic, is that they get sick. They're infected most of the time. They remain asymptomatic, or they get sick mildly and they just wave it off and then they move on. So those who really get sick are those the older you are, the more you get sick. So that is the rationale of rationalizing the vaccine and focusing on the children a little bit later.
Okay, thank you. Before we go on to our next question, I just want to quickly remind colleagues that the link to register for that first public health conference in Africa that was mentioned by Dr. John is now on the chat, and you can have a look at it, take note of it, so that you are able to register as soon as we finish our briefing. So that is the link for the first public health conference in Africa that Dr. John referred to earlier, and that link has been placed by Neke on the chat section. So please do take the opportunity to take down that link so you can use it later. All right, we now proceed with our questions. And Elizabeth Merab has come back with another question. And she says, Kenya this week announced that unvaccinated people will not receive government services from December 21st. With many countries, vaccination coverage still low, is it time to have stringent measures to increase vaccination? And it has always been about free will to choose whether or not to get vaccinated.
So that is what I said earlier. That, I mean, first of all, you expect to see that trend move across the continent. Move across the continent, meaning that many more countries will be adopting such a policy. Because the leadership is extremely concerned that efforts have been made to acquire these vaccines, but the population is not picking up the vaccines, which is unfortunate. And then it continues to create a burden, a health burden and an economic burden. We just have spent a lot of time discussing the next wave and the effect of that. A lot of that could be mitigated by large number of people vaccinating. So I think you see that policy shift where many more countries will be going through vaccine mandates across the continent. Now, the situation has changed a lot in Africa with respect to availability of vaccines. That situation has changed. I mean, we cannot longer use the justification of the past to make a case that people are not having vaccines. The vaccines are there. I can give you numbers of vaccines by countries that have arrived, and the uptake is low. If you look at the presentation today, I said that only 55% of vaccines that have arrived have actually been used now on the continent. That is really an unacceptable situation because of the distribution. Okay, and so which means if people want to be vaccinated, they can be vaccinated. And I'm really making an appeal. I know I've said this over and over for everyone on the continent who can who have access to vaccines to go get their vaccines. And that is the only way that we can protect ourselves. So, and avoid that the leadership, the political leadership will impose a mandatory requirement for vaccines to visit facilities or to do any type of functions.
All right, thank you, John. We have another question coming from Maggie Fick from Reuters. And she says, do you have any information as yet on who will get the vaccine doses that South Africa does not want?
I'm not aware of those, which vaccines South Africa doesn't want. If you can just shed some light on which are the vaccines that South Africa doesn't want. I'm not privileged to those to the conversation of which vaccines South Africa is not wanting.
All right. So let's go back online, and we have Sarah Jeving, who has another question. Sarah, please go ahead.
Thank you so much. We've been stuck at around 6% for quite a while in terms of vaccination figures. Why is the percent figure not rising more rapidly, given that there's been an uptick in vaccine shipments in recent months, starting in July? Thank you.
That's a very good question. I mean, we are at 6.66% now. We need to unpack that number to see which countries are actually doing better. Well, let me step back from that. Who are those countries that are doing a better uptake in vaccines than others? So let us devote a good chunk of our briefing next week with respect to those countries, and just kind of look at all 55 countries who has received what amount of vaccines, what have they used, and where are they with respect to their full coverage there. I think that we will provide you with a detailed, comprehensive review of the situation at the next briefing.
Okay, Maggie Fick has come back quickly, and I think this is related to another message. So I will read both of them. So she says that the vaccines that she's talking about are the J&J and Pfizer vaccines. And she says that South Africa has asked the suppliers to delay supply of the vaccines. But let me link that with an earlier message, which I also believe is from Maggie. And it says that South Africa has asked Johnson & Johnson and Pfizer to delay delivery of COVID-19 vaccines because it now has too much stock. And this, she says, has come from the health ministry officials. So she has clarified the types of vaccines that she was talking about.
No, absolutely. It is not. It's not a rejection of the vaccines. I think it's very common for countries to look at their stock, what they currently have and have not used, and then ask the distribution to be delayed so that they can clear their stocks. Otherwise, to avoid the issues of expiration. We've seen that with our own. At the AVAT distribution, where countries have come in and said, look, we still have some vaccines in stock. We've just received an extra donation from another country, so delay the shipment there. So I will not read a lot into that. And I would not be surprised that in the coming weeks, the existing stocks that South Africa has would have been used up, and they will be requesting that those vaccines, especially from Johnson & Johnson, be shipped to them. And South Africa might have purchased the Pfizer vaccines. I'm not privileged to that. And if they did that, then of course they have arrangements that allow them to define when the vaccines should be shipped and when the vaccines should be delayed. So I truly will not read so much into that. It's very common practice.
Okay, I think let's now take our last question, and it's coming from Judith Akolo, who's with the Kenya Broadcasting Corporation. And she says, if children do not get very sick, is there a need to have them vaccinated? And she says, I'm asking because being vaccinated does not mean that they cannot still continue to transmit the virus, since vaccination only prevents severe illness from the disease.
So for children, actually, my take is simple, Judy. As I said earlier, let's use science to inform what we are doing. So children, as you rightly said, and everybody, once you're vaccinated, a couple of things happen. Once your antibodies have been developed, you decrease the viremia, or what you call viral load, around the areas that transmission occurs, that is around your nostrils and around your mouth. So that is very clearly important. Because of that, it decreases the ability to move the virus to somewhere, decreases the ability. It doesn't stop it from happening, but it decreases that significantly. Very, very important. But then what the vaccine actually does is that it decreases severity of hospitalization and deaths. I think that is also important. This, for children, the question now becomes, how do you make sure that what is the overall goal of that? Is it to stop the children from being infected? And if they are infected, from getting a severe disease, which is limited in that category? And that's what I'm saying. Let's wait for the science to tell us that, because if you recall earlier on, younger people in Africa were infected and they were not sick, they were symptomatic. But over time, they started falling sick and actually dying. So that changes the dynamics again completely. So again, only science will inform us of at what age group are people being infected, and especially the children, are they being infected? And what does a vaccine really do in that age group there? For one thing, vaccines do not harm them, do not harm that age group. But do they really have a significant public health impact? I just don't know. I think, wait, you're muted?
Yeah. All right. I've unmuted. Thanks a lot. Thank you very much, John. Now, colleagues, before we get to the final comments from the Africa CDC director, let me just remind you of that link. In fact, there are two links that Nekeron has put up on the chat section. And one is to enable you to register for that conference on public health in Africa as a media representative. So that's one. Then below that, there is another link for you to register for a pre-conference virtual workshop for the media. So this one is going to happen before the main conference, and there is a link to that as well. So as Dr. John is giving his final comments, please just make sure that you register for those two very important workshops. All right, now, Dr. John, it's time for you to give us your main headline points from this briefing today.
As you probably have perceived from my insistence and repeated appeal to the continent, my message today will be that we are approaching the end of year season. December will start next week, and December to January, a period of festivity that we all deserve. It's been a tough year, or the tough past 2 years, and all of us deserve to celebrate with our families. But let's do that with safety at the back of our mind, that this virus is still there and is so much there. And remember last year that we issued the same warning, and in January we saw a very big outburst of virus there. So, and what are the advice, and we'll repeat this advice over and over during the holiday season, is that once you're indoor, it offers an opportunity for transmission. So when you're indoors celebrating, keep your windows open, the doors open, let there be free flow of air as much as possible. If possible, get your good dinner or barbecue out there in outside so that you can get more fresh air circulating to reduce transmission. We're just giving you as best public health guidance so that you can celebrate safely. And secondly is that avoid large crowds as much as possible. I mean, large gathering without masks offers an opportunity for the virus to be transmitted, even if you are vaccinated. We all know that breakthrough is common. I had my Pfizer vaccines in April. The 30th was the last vaccine. I still had a breakthrough in August. So it is there. I mean, it's a possibility. It's not theoretical possibility. It's a real possibility. So as we celebrate, go to the end of the year holidays, we should make sure that we keep in mind, even those who have been vaccinated, that you can still have a breakthrough. Let's continue to adhere with public health measures as much as possible, and especially protecting the elderly. And lastly, we live in a multi-generational settings. As you go into the holiday seasons, let's protect our grandmothers, our grandparents in the villages that we will visit them. You don't want to go bring virus from the cities and to the remote areas and create havoc there. I think let's be mindful of safety. Let safety be on our minds all the time, that in the middle of a pandemic that is severe, and we have not seen the light at the end of the tunnel because of the low rates of vaccinations. So I think that would be my message. I mean, I will repeat this over and over during the course of this holiday season until the end of December. But otherwise, thank you for being on the platform this Thursday, and we'll continue next week with an in-depth analysis of the vaccine situation and the vaccination situation on the continent.
Thank you very much, John. That was Dr. John Nkengasong, the director of the Africa Centers for Disease Control and Prevention, the Africa CDC, which is an institution of the African Union. And he was taking us there through the situation of COVID-19 currently on our continent, and just ended there with some very pertinent and practical advice regarding the upcoming festive season. So colleagues, that's it for today, but we will be back next week on Thursday at the same time. So join us then. Bye-bye.
Bye-bye.